Welcome everyone, Dr. Mandel here. I'd like to add to our collection of chronic sinus problems, difficulty breathing, eustachian tube dysfunction, all those crazy sounds that you may be hearing, that tinnitus, as well as vertigo, that dizziness. Well, this technique I really think you're going to love. Why? Because the results are fast. The biggest issue with congestion and sinus and difficulty breathing and all that pressure you may be feeling in your ear has to do with the foods we eat, things we're allergic to. But the problem is such a major epidemic that everyone's complaining. So this natural remedy that I developed, I really think you'll be happy. It only takes 30 seconds. Our objective is to open up the eustachian tubes. The eustachian tubes connect the back of the nasal region to the middle ear. The purpose of those eustachian tubes is to allow proper balance from the inside of the ear to the outside. And when that balance becomes off as a result of congestion and extra mucus, then we start experiencing all kinds of crazy symptoms, like ringing in the ears, that whirling, that buzzing, that humming, and that can be quite annoying. So modern science has always taught us that when our ear becomes clogged, maybe you're up in a plane or just having congestion from sinuses, they say chewing gum is good. The reason is because every time we open our mouth like this, the eustachian tube opens up, therefore allowing the body to have natural drainage. Because the TMJ, our temporal mandibular joint, is directly related to so many of these different symptoms, what I've discovered is that if we take the mandible and push it as far forward as possible and hold it in that position, as well as opening up our nostrils at the same time, that's going to accelerate the body's healing by opening up those eustachian tubes to reduce that pressure and hopefully your symptoms. I'm sure that one time or another someone has challenged you to open and close your nostrils like this. Some people can do it better than others, but that's okay. What I'd like you to do first is take your hands, and I want you to grab the mandible area on the side, and I want you to squeeze it together. And I want you to relax the jaw, and I want you to push the jaw as far forward as you can, and we're going to hold it there within about 30 seconds. Squeeze it and pull it forward as far as it can go and hold it there. Just pull it forward, you'll feel a stretch, and hold it there. Right now we're opening up the TMJ joint. Now, open your nostrils up as wide as you can. Hold them open. I know you may be laughing, but hold it open as you pull that jaw forward. And you're going to hold it open up to 30 seconds. As the jaw is being pulled forward, opening up the joint, as eustachian tubes are staying open in this position, as the nostrils are opening and release. Now, I bet the majority of us is going to feel some change behind the nasal region. That is the eustachian tubes. That is stimulating the area. And you're going to notice possibly dripping and swallowing. You may even sneeze. Your eyes may run. The bottom line is we are accelerating the healing process to get the sinuses to drain, allowing the eustachian tubes to open up, and allowing your body to repair and heal. I am confident that the majority of you are going to experience great changes. Do this technique several times a day. You'll notice that after you perform the technique, within 5 to 10 minutes, you're going to continue to get great results. So I hope that you can continue to diminish or even wean off those medications that are causing those possible side effects that you're having. I ask you to share this video on your social media. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandel.